Hey guys, it's kind of spoony, and today I've got a surgical update for you. But first, I'll show you the operations I'm talking about.
And the procedures performed, which are typical for an Ehlers-Danlos patient: proximal lead and nerve release, release of the radial tunnel, capsular stabilization wrist for dynamic pseudodissociative carpal instability, and Eaton Littler ligament reconstruction using a strip of the FCR tendon, carpectomy of the pisiform, just an extensor pollicis longus tendon realignment here, and realignment of the extensor tendons. The main operation that every Ehlers-Danlos patient needs is the release of the median nerve, and it gives you the strength back to these two muscles.
That was a lot to cover. I'm glad that he's the doctor and he can explain it better than I can. Let's get into this side by side. I'm just gonna go from fingertips up to my biceps, starting with my fingers. On the right hand, I've discussed before, this tendon will need to be redone. I actually squeezed too hard and popped it when it was healing, but the fingers and the tendons stay pretty much where they're supposed to on this hand. On my left hand, it is much tighter and still a bit tender. And you can see that there and there is where he reinforced the knuckle on this side. I got pretty good range of motion with both of them. My right wrist is much stronger than it was even 2 or 3 months ago. It feels great. It's got really great range of motion, no nerve pain. My left wrist has great range of motion, still tender. For my thumbs, you can see how the tendons stay put and move through the wrists like they're supposed to, and where the nerve releases have been done. On my right side, feels great. It's felt much better since the surgery. Like, I don't have shooting pain from here down into my thumb and fingers anymore. And the same is true on this side. And then you can see this incision here is also healed really well. There was a band of fascia that was cut on this side, on this side. Finally, one of the shots that I get the biggest kick out of is just comparing my two arms side by side and just letting them relax, and it feels very nice, very loose. If you have a connective tissue disorder and you're considering surgery, I can't recommend Dr. Ericson enough out of Seattle. EricsonHand.com will give you all the information that you need, and I hope that helps somebody. Thanks.